Hello, everyone. I hope you're having a great day. And this is Dr. Valerie with Healing Wings Dental, which is a place where we help people maintain or regain their oral health. So, anyway, what I want to talk to you today is how to alleviate TMJ pain. Because last time we kind of tried to describe what the TMJ was and what was some of the things that would cause TMJ and how also to recognize that we are having or experiencing TMJ issues. So today I want to kind of recap a little bit and then we're going to go into different things that you can do in order to help you alleviate that TMJ problem or TMJ pain that you may be experiencing. So again, the TMJ is that temporomandibular junction, or it's the articulation that is linking the jaw to the rest of the skull. And again, there are many different things that can that may cause you or allow you to know that you're suffering some issues with your TMJ. So if you're hearing when you're opening your mouth some click or some popping or some crepitus in those areas, or sometimes if you're feeling pain, you can know that you have some TMJ issues. You can feel like some tension, or you can also feel like some pressure, and oftentimes it's associated with pain. So if you're experiencing some of these symptoms, you might want to kind of like have a thinking along the lines of TMJ issues or TMD, TMJ disorders. So that's what we talked about last time, and some of the ways that you can end up having those kind of issues. It can be due to stress, or it can be due to the fact that you are over stressing your jaw by maybe like chewing on things that you're not supposed to, like pens or pencils, or you are chewing on gum too long or opening your mouth too wide. Things like that, can cause you to start experiencing some TMJ problems. It could also be due to trauma. So, if you had sustained like a blow or a fall when you were young, maybe, and your TMJ did not develop well, or, even as an adult or as an older, when you were a teenager or, older, after you have already done growing, you can still, experience some accidental trauma events that can actually cause your TMJ to start having problem. Bruxism, if you're a grinder, you grind your teeth often, or you clenching, that can also cause you to start developing some TMJ issues. So now that we have kind of like recovered a little bit of what we talked about last time, what are some of the things that you can do in order for you to alleviate or decrease that TMJ problem or pain that you may be experiencing? One of the things that you can do is you can start doing massages, and you can have regular massages, maybe like in a massage place. They can help you by massaging your neck, your shoulders. That can help you alleviate the problem. But also you can use some warm or some warm hot or some cool compress. So you take some towels and either put in some very hot water, or you can also use some cold packs. And what you're going to be doing is you're going to use those towels and put them around this area, so around the articulation, in around near to your ears. And then what you're going to do is you're going to be massaging in circle. You're gonna massage, and that's going to help you start like releasing that tension. Another thing that you can do is start doing some jaw exercise. So I usually do it in the office. With the jaw exercise, I would use oftentimes some warm compresses, and I put it around the area. Say, for example, the patient, is starting to feel pain on their jaw. I take a little break from maybe doing treatment, and I'm going to start putting the warm compress around the same area that I'm telling you, the TMG. And then I'm going to start going in circles. So I'm starting by massaging, and then I'm going to start to ask the patient to open and close their mouth slowly. So very slow movement while I'm massaging and I'm having that cold compress, and the patient is going to open wide and slowly, like and then close. So open and close, open and close, open and close. And then I'm going to massage again. And after that, another thing that I'm going to have them do is to slide their jaw side to side. So go left to right. And you want to do those movements, you want to do them slowly. So you can start by slow movements. You're going left to right, really slow movements and small movements. And then you can start increasing those movements over time. Another thing that you can also do is to slide your jaw forward. So you're going to slide your jaw and bring it back. So but you want to make sure that you're doing those movements slowly. Then after that, you're going to keep massaging and massaging, and that can help you release that tension. And many patients have said, that after we have done that, that's going to decrease that pressure that they were feeling. So that's one thing that you can do. Besides applying heat or cold, another thing, and apply aside from doing jaw movements, you can also take some pain medication. So you can take some over-the-counter pain medication, but obviously when you do that, maybe Tylenol or perhaps Motrin, when you take that, you want to make sure that you're following the direction that's on the box of the medication, so that you don't overuse, pain medication. You can do that. But, another thing that you can do is definitely make sure that you're seeing a doctor. But prior to doing that, so as we said, and as I said earlier, some of the things that can actually cause TMJ problem, and I'll come back to going to see a doctor. What can exacerbate the joint is when you're opening and closing your mouth too wide. So maybe you're eating food, maybe like a hamburger or something like that, that's too big for you. So like an easy fix for that would be for you to actually cut down, smaller pieces and just putting in your mouth and eating. I know, you might want to actually engage in that, in that activity, knowing that you're eating a burger, but honestly, it's not, just that movement of just opening your mouth so wide, that's going to help you enjoy the burger that you're eating. So cut it down in smaller pieces, and that's going to decrease the tension that you may place, on the TMJs, on both TMJs. And also, people can overdo chewing gum, and when you're chewing your gum too much, yes, that can also start, causing you issues. So you want to kind of like refrain from over chewing gum. So those are some of the things that you can do on your end, but obviously you want to make sure that you are actually diagnosed. So you need to go to a dentist, and the dentist is going to be diagnosing if you do actually have a TMJ problem. And if it is a doctor that takes care of those issues, then they will direct you along those lines, or they will recommend you or refer you to a specialist that actually takes care of those issues, because maybe they may decide to create some devices for you that will help you actually starting to treat you, or they may prescribe some open medication and anything else, or you may be a candidate for surgery. Whichever they recommend is what you want to make sure that you do. And if you are a bruxer, meaning that if you actually grind your teeth, then it's very beneficial for you to be prescribed a mouth guard. So the dentist will take a mold or take a scan of your teeth, and then they will send it to the lab. The lab will create a mouth guard for you that you can use at night, because as we said before, stress and anxiety, grinding and clenching can really cause a lot of pressure on those TMJ and TMJ's areas, and causing you TMD. So those are some of the things that I wanted to discuss with you today, and I really hope that you have found this information very helpful. And if it is the case, please don't hesitate to share it with your friends, with your family, with your family members, with your co-workers, so that they too can benefit from the information that we have provided you with on this day. And if you do have a doctor that is seeing you regularly for your routine checkup, please keep going. But if you are in our area and you do not know anybody that can take care of you, we are Healing Wings Dental. I am Dr. Valerie Mukanga, well equipped to help you on your journey to a good oral hygiene and oral health. So we are located in Arlington, Texas on 4101 Green Oaks Boulevard, suite number 317 in Arlington, Texas. And our zip code is 76016. We may be called also at 972-213-0202, or you can find us on our website, www.healingwingsdental.com, and you can secure an appointment on the website, or request an appointment, and we'll be able to help you strive in your oral hygiene and your oral health. So that was what I wanted to tell you today, share with you. And as always, I keep you with many, many blessings. Be blessed in this day, and make sure that you make your day positive, because it is within your power to do so. Be blessed and have a great day. Bye-bye.